Hi, my name is Madison Anderson. I use the pronouns she, her, and hers, and I'm Anishinaabe from the Fond du Lac Band of Lake Superior, Chippewa, and I am the Tribal Public Health System Consultant with MDH. We're having this conversation today because it's important that we make it known that we have a need in our Indigenous communities for healthcare workers. Indigenous peoples are inherently scientists. Everyone is inherently a scientist. We're all constantly collecting data every single day. Everything is helping us make decisions towards that next thing. And so, one important thing that we think about as Indigenous peoples is how we're relearning that we're researchers, we're relearning that we're scientists. And part of that is getting degrees, but part of that is also trusting in our traditional knowledge as well. I'm currently pursuing a PhD in epidemiology at the University of Minnesota, and they also just started a BA in public health, which is very cool. We need more of us. We need so much more of us to be able to pull these conversations forward and to really help that next generation fully survive and thrive. In Western cultures, they typically view healthcare as more individualized. And so it's really great to be able to see the representation that we have of Indigenous public health practitioners right now, because we know that on population level, we love to be able to be a community. We love being around other people. We love family. And so one thing that's been important in regards to indigenizing public health has been, reclaiming that idea of group therapy and making it known that that's actually traditional. We have been doing talking circles for eons. That is how we have made major decisions, how we've talked through major things. So it's really cool to be able to see that we have, not only Western culture, but we're able to provide that traditional knowledge with Western culture. It's not necessarily an either or, but it's the best of both worlds. When we're talking about working with tribal nations, we're talking about working in partnership with the tribe and really having their sovereignty and self-determination move forward their goals and their objectives. How do they determine themselves to be healthy? What is the best things that is going to make them healthy is really just up to them. And so in regards to conducting research, like we've seen people come in, um, we've seen safari research happen where people come in and they take data and then they don't do anything in regards to relating that data back to the people or the populations that those very real data represent. And so with that, in my research, I've been trying to be better being ethical and meaningful with my data and making sure that I continuously make sure that I'm getting feedback from my research team, but also a community oversight board of people who have lived experience on that research topic. Really pulling in from the expertise, not necessarily those with higher ed degrees, but also those with that lived experience of traditional tobacco, which is what my dissertation is on.